Pregnancy brings along many emotional and physical changes, but one change you may not have expected is round ligament pain. The good news is that the pain is usually harmless, and understanding its cause and how to manage it can make a big difference. After watching this video, you should have a much better grasp of what round ligament pain is and different ways you can treat it. Hey everyone, my name is Cara. I am a certified pelvic floor physical therapist at EW Motion Therapy in Birmingham, Alabama. I absolutely love working with pregnant and postpartum women through their motherhood journey. In today's video, I want to talk more about what round ligament pain is, different ways you can treat it at home, and how a physical therapist like me can come along beside you to help. Let's get into it. Let's start with the basics. What exactly is round ligament pain? It's actually a pretty common part of pregnancy, and while it's not dangerous, it can definitely be uncomfortable. The round ligaments are these rope-like bands of connective tissue that help support your uterus and keep it in place. They run from the front of the uterus down the groin, and as your pregnancy progresses, those ligaments stretch and thicken to keep up with the growing baby. The problem is, when they stretch, they can also get tight or strained, especially when you move suddenly. That's what leads to those sharp stabbing pains some women feel. Usually, the pain is on one side of the lower belly, but sometimes it can be on both. This kind of pain tends to show up most often in the second trimester, which makes sense because that's when the uterus starts growing more quickly. It's often short and sudden, and it can catch you off guard when you're just getting up, laughing, coughing, or even rolling over in bed. A big clue is that it's almost always triggered by movement. The pain tends to stay in one place, either low in the abdomen or near the groin. It doesn't shoot down the legs or radiate to other areas like sciatica might. And most importantly, it usually doesn't come with other symptoms like fever, chills, or stomach issues. If it does come with those, that's your sign to call your provider and make sure everything is okay. So what's really causing all of this? It's actually just your body doing what it's supposed to do. Pregnancy hormones like relaxin start loosening up your ligaments and your joints to prepare your body for birth. But that also means those ligaments, especially the ones holding up your uterus, are a little more prone to getting overstretched. Knowing all of this can be reassuring because it helps you understand what's going on. But just because it's normal doesn't mean you have to suffer through it. The good news is there are plenty of ways to manage round ligament pain right at home. They're simple, safe, and can make a big difference in how you feel day to day. First step is to move gently. One of the easiest things you can do is just slow down a little. Sudden movements like popping up from a couch or twisting quickly can trigger that sharp pain. Try to move a bit more deliberately. It might take an extra second, but it's worth it. Next, try a warm compress. A warm compress on your lower belly can work wonders. It helps relax the muscles and increase blood flow, which can calm down tight ligaments. Just make sure it's warm and not too hot. Some light stretching can also help relieve the tension around your pelvis and belly. Try cat-cow poses, pelvic tilts, or even simple hip flexor stretches, but keep it super gentle. This isn't the time to push yourself. If you're not sure where to start, talk to your provider or physical therapist who specializes in prenatal care. They can show you the safest moves. Also, consider a maternity support belt. These are soft, supportive bands that go around your lower belly to help distribute the weight more evenly. A physical therapist can also use taping techniques to relieve lower abdominal pressure. The belt or taping method can take some of the strain off of your round ligaments and make walking or standing for long periods a lot more comfortable. Don't forget to hydrate. It's easy to underestimate how much hydration matters, but your muscles and ligaments need water to function properly. Dehydration can make everything feel tighter and more crampy, so aim to sip on water throughout the day. And finally, take a deep breath. literally. Stress and tension can actually make pain worse, so it's worth taking a few minutes each day to breathe deeply and relax. Whether it's some gentle yoga, a short meditation, or just sitting quietly, calming your nervous system can help ease physical tension. Okay, so we've talked about what round ligament pain is and how you can manage it at home, but what if you feel like that's not enough? Or maybe you just want a little extra support to stay active and comfortable as your pregnancy progresses. That's where physical therapy comes in. Physical therapists who specialize in prenatal care know exactly how to help you move more comfortably and safely. Let's start with customized exercises. One of the biggest perks of working with a physical therapist is getting a routine that's tailored just for you. They'll create a gentle stretching and strengthening plan that supports your core and pelvis, which are the key areas that help carry the load during pregnancy. Strengthening those muscles not only eases the strain on your round ligaments, but it can also help your body gear up for labor and heal more easily afterwards. Then there's manual therapy. This might sound intense, but it's actually super gentle. Physical therapists can use hands-on techniques to ease tension in your abdominal and pelvic muscles. This is all done with your comfort and safety in mind, and it can really help loosen things up and get better blood flow to the area, which means less pain. They'll also teach you how to move smarter. Certain things like bending over or even just getting out of bed can suddenly feel super awkward during pregnancy. A physical therapist can walk you through adjustments to your posture and everyday movements that take pressure off your ligaments. Trust me, learning how to sit, stand, and sleep with better alignment can make a huge difference. So if round ligament pain is sticking around or starting to interfere with your daily routine, physical therapy might be worth looking into. Remember, while round ligament pain is usually, and unfortunately, normal, it's important to check in with your healthcare provider if the pain is severe, constant, or comes with other symptoms like fever, bleeding, or difficulty breathing. With the right support, you can focus on this exciting journey ahead and enjoy this special time with more ease and confidence. If you are interested in learning more about prenatal physical therapy, watch our video linked below called "Do I Need Physical Therapy During Pregnancy?" This video talks about the best time to start and more ways it can help.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.